Hey, Dr. St. John here, part 2 of the TMJ jaw. So what do we do in our clinic to handle and address these issues? Well, we diagnose what is causing this TMJ issue, and it can be multifaceted. The first thing we're going to check is we're going to check if you have any type of nerve irritation. The upper neck or the upper cervical nerves and lower skull, if those are out of alignment, they're going to pinch nerves that feed the jaw. And if those aren't addressed, you're not going to have any success at a lasting result. So that needs to be addressed first and foremost. Number 2, we need to handle the muscles. And the muscles of the jaw are fairly complex. You have 3 closers, and I talked about a little bit of this, and I showed you some pictures in the first video, but you have the masseter. Think about mastication. That's a technical term for chewing your food, right? So if you actually clench your teeth, watch how my finger pops out. Okay, that's that masseter muscle contracting, and that's a jaw closer. It's actually the strongest muscle per square inch in the body. Very powerful muscle. We have a muscle that fans out over the side of your temples and the side of the head. It's called the temporalis, and that also will help close the jaw. And if you just put your hand up here and clench your teeth, you can feel those muscles pooch out, and they're actually contracting. So you have one of those on each side, a masseter on each side, of course, and then you have 2 muscles inside, sort of where you get food stuck on between your cheek and your gum up there. You have an internal and external pterygoid, and it starts with a P, P-T-E-R-Y-G-O-I-D. So you have the internal and the external pterygoid, okay? A medial or inner or a lateral outer pterygoid. One is a jaw closer and the other one is a jaw opener. So sometimes we have to get into those, and we have to manipulate and do some soft tissue work on those along with the other 2. It's all a balancing act. So once we get that accomplished, then we're going to look at the acupuncture system, because there are specific acupuncture points that go right through the TMJ. I'm going to show you a picture of this. So you can see it right here. Those little black dots are acupuncture points, and they're related to the stomach. And if those are blocked, then those need to be addressed through acupressure and other methods. Okay, so those are the first key areas that we look at in the clinic to handle a TMJ issue. We're going to be looking at the spine and the cervical region to make sure all that has 0 defect, everything's balanced, there's no pinching or irritation there. We're going to look at the muscles. We may do some soft tissue work to repair and correct and balance those out. And then we'll look at the acupuncture circuits and make sure those are flowing properly. So, that's in 3 minutes or less, many of the key factors that we look at. And in part 3, I'll go a little bit deeper. Take care.